Welcome back. Today we're going to be talking about eye injections. Eye injections, they're a big deal in my clinic. I do a lot of eye injections. They're really helpful. Injections are a very good thing. You'll see why in a minute. I'm going to show you examples of why they're good. But there's some other ugly sides to eye injections. So we're going to be talking a lot about it. I've kind of intended this video to be for someone who has received a couple eye injections and maybe they're curious about why do we do them, or what did the doctor say to me about the risks or the process or the benefits of an eye injection, for example. I've also designed this for someone who's never had one before. Maybe someone has received a recommendation to get an eye injection and they thought, I want to think about it a little bit and study it. Um, this might be beneficial for you too, if that describes you. If you're a pro at eye injections and you just want to study more about it, learn more about it, then you might find this beneficial as well. So, who am I? My name is Zackery Oakey, a retina specialist here in Irvine, California. That's me looking all schnazzy in my suit that I never wear. I don't wear suits. I'm a pretty chill guy, nice and laid back. That's the building. If you're ever in the neighborhood, feel free to come on in. So, every talk I give on this channel starts with understanding the anatomy of the eye. Remember I told you I'm a retina specialist. That means I work back here in the back of the eye. The retina lines the very back of the eye. It has one job. It feels light. So when light comes into the eye, it's put into focus by the cornea and by the lens, and it travels all the way to the back, and it's felt by the retina. The retina feels the colors and the light. And then it tells the optic nerve next door what it felt, and then the optic nerve goes to the brain, and this is how vision happens. The overwhelming majority of the eye injections that we perform are for problems in the retina. It is so rare that someone would receive an eye injection for anything other than a retina problem, at least in the clinic. That is, if there's a problem in the lens or the cornea, we don't really inject the eye for that. 99.999% of the time we're performing an injection in the eye for a problem back here. So I'm going to show you some examples of conditions that we treat with eye injections. If by chance you have this or you're interested in studying this condition a little bit more, you want to see more videos about this, I'd encourage you to look through my channel here, and you can see all sorts of other content about these specific conditions. I just want to give you an idea of like what is happening with an eye injection. So this is an example of a condition that's treated with an eye injection. It's called a retinal vein occlusion. A retinal vein occlusion is a problem where one of the veins on the inside of the eye is having a hard time taking blood out of the eye. And when that happens, the retina gets really bloody. You see in this photo, this is a retina back here, and there are all these bleeding spots everywhere. And then there are these white, crusty looking little deposits. And then if we scan the retina, the very middle right there, to see what's going on, this is what the retina looks like in the middle. It's very swollen. There's fluid underneath the retina. This person is legally blind with this condition. There's another problem that we treat with eye injections, and that is called wet macular degeneration. This is a condition that has a strong basis in genetics. There are two forms, the dry and the wet form. And for the wet form, we universally recommend eye injections. This is someone with the condition. Again, looking at the retina, there are these little yellow kind of deposits here and there. And then if we scan the retina in the middle, this is what it looks like. There's fluid accumulating underneath the retina. This patient also is not seeing too well. Another reason why we inject the eye quite a bit is something called diabetic retinopathy. When people have diabetes and they've had it long enough and it's been severe, like for example, the blood sugar, whenever someone pricks their finger or looks at their sensor, it says 300, and it's been like that for a long time, then the retina can become a problem. Basically, when people have this condition, the blood flow in the retina gets really bad. And so the retina starts to form these weed-like, crappy blood vessels. And that's what's being pointed out here with these arrows. For example, if you look at this arrow, there's this weird-looking blood vessel right there. And if you look at the blood vessels that are next door, they look nice and normal. Those are the ones that we were born with. But if new blood vessels start to form on the surface of the retina, they look like this. Some of them, if not all of them, will at some point start to bleed inside of the eye. That's what's being illustrated here. So you can see there's a blood vessel right here. It looks abnormal, and then there's bleeding right next to it. And there are many other examples in this photo. There's a new blood vessel there, there, and there. This is what it looks like when someone has a lot of bleeding inside of the eye from diabetes. Notice here there are those funny looking little blood vessels here, there. We got a couple right here, for example, and then there's all this cloudy blood on the inside of the eye. Again, this person is legally blind. But for all of these conditions, we can perform eye injections and make things better. So returning to the first example of a retinal vein occlusion, this is what it looks like when we inject the eye with medication. So we started off with a really swollen retina when we scanned all these bleeding spots, and then after injections, notice how much better the retina looks. There are far fewer bleeding spots, and when we scan the retina looks nice and healthy and normal, almost. Now, there are some subtle things that are wrong, and the vision is probably not totally perfect, but they are certainly went from legally blind before eye injections, and now they're not legally blind after eye injections. And then when we look at macular degeneration, again, the wet form, we scan the retina before and after an injection. It's starting to look more like a normal retina. The vision is better. And in the case of diabetic retinopathy, again, this is the eye before an eye injection, and if you just pay careful attention, there's this crappy blood vessel here, and if we look in that exact same location, it's totally gone. It's magical. And look at the blood too. That little weed-like blood vessel, that's gone, and then the bleeding is starting to go away as well. So we love eye injections. We cure blindness with them. Now, if we do an eye injection, people kind of wonder, like, where are we doing it? So if we go back to our model of the eye, when we perform an eye injection, we're not putting like a needle right here. If someone, for example, has wet macular degeneration, that is in the macula, there's a problem. We don't place the needle into the retina. We actually just enter the eye with a tiny little needle right here, just behind the lens, just in front of the retina, in a place we call the pars plana. You might say, that looks like a delicate place. Indeed it is. You have to be really trained to do this if you want to do it correctly. People who are retina specialists know how to do this because they do it a lot. When we're in retina fellowship, we learn how to perform these injections inside of the eye. And so if you hear of a condition that requires an eye injection, my best advice is to go to someone who's trained to do it. That way they do it in the correct location, and also they understand the diseases that require injections, and they can also treat any kind of complication or risk that might happen after an eye injection. Speaking of risks, there are risks to eye injections. So we've discussed the benefits of eye injections, where they're done, who does them, and so on. But there are, of course, risks. Like if you inject anything, inject a shoulder with a vaccination, for example, there's a risk. You feel a pinch, there might be an infection, and so on. Well, those risks also apply to eye injections. And there are three basic categories of risks that are related to eye injections. And for the rest of the video, this is all we're going to be talking about. So what are those three risks? There's a risk of pain. Makes a lot of logical sense. You inject something, it might be painful. The eye can look red, and then there can also be an eye infection. Of the three things, infection is devastating. It can be vision threatening, but pain is temporary. A red eye goes away, and I'll describe that in a minute, but eye infections are really serious. So we're going to spend a little bit of extra time on the infection aspect to the risks. But let's address all of these in turn. First, let's talk about eye pain. So when we perform an eye injection, we place a needle in the eye. But before we do that, we like to numb up the eye. We like to put numbing drops on the surface of the eye. And then in most cases, at least in my clinic, because I really don't like pain, what I usually recommend is a little injection of lidocaine, not into the eye, but on the surface of the eye. So when that happens, a patient would feel a little bit of a pinch. That is, we place numbing drops on the eye. That helps the eye feel better. And then when we place a little bit of lidocaine on the surface of the eye, there's a pinch. That's it. Now, there are some people who don't like that for various reasons, and I don't judge them. It's okay. We can place just numbing drops on the surface of the eye and not do any added numbing treatments like a lidocaine injection on the surface of the eye. And when that happens, certainly the pinch is more prominent. In other words, there's more pain when we do it that way. But that it certainly is one way that that can be done. And in various stages of my career, I've treated patients that way. And most people tend to tolerate that okay as well, even though the pain might be greater. But these days, I'm getting to be an old man. I want to avoid pain if possible. And so when a patient comes to my clinic, I try to do everything I can to avoid that. And that involves a separate treatment of lidocaine on the surface of the eye. Now, the next risk is eye redness. Now, an eye can look red just like this after an eye injection. If you look at these photos, for example, in this person's right eye, off to the right side, it looks quite red there. Or in this person's left eye, off to the right side, there's also some redness right here. This is called a subconjunctival hemorrhage. And it looks crazy, doesn't it? If you see someone with an eye like this, you might be wondering, are you okay? Can you see okay? How does your eye feel? Truth be told, these people see just fine. Think of this like a bruise on the eye. Now, it looks crazy because the white part of the eye is a very useful part of the face. In what way? In the way that if we want to know if someone's looking at us, and we look over at someone, if their eye is looking right at us, how do we know that? Because the white part of the eye and the brown, black part of the eye is looking right at us. In other words, the white part of the eye carries a lot of information. This is how we know that someone's angry. Like if someone's angry, their eyelids go like this. You see less of the white part of the eye. If someone's excited, you see a lot more of it. In other words, this is a very emotional part of the face. And so if it turns red after an eye injection, people get really worried, or they get angry or concerned or whatever. I totally understand that because of the significance of the white part of the eye, but nevertheless, this is not serious. This is almost literally exactly like a bruise. So if you bump into a tabletop, your hip bumps a table or something and you get a bruise there, yeah, it looks a little ugly. It goes away over the course of a week or so, maybe 2, maybe 3 weeks, but that's the end of it. You can't do anything to make it go away. If you have a bruise, there's no ointment, there's no medication that makes a bruise go away. It just goes away because the body cleans up any kind of little bleeding that might happen. The same thing applies here. When I perform an eye injection and someone has a red eye, I'm asked all the time, how do I make this go away? Everyone is talking to me and worried about me. I want to make it go away. Guess what? I have to say there's nothing that can make it go away. Literally exactly like a bruise. There's nothing that can make it go away. And why does this happen? If you look at the white part of the eye where we perform the injections, there are thousands of blood vessels everywhere. Thousands of them. It's kind of amazing to me that not every eye injection causes the eye to look red. In fact, I'd say it's somewhat of a 1 in 4, maybe 1 in 5 probability that someone would have a red eye after an eye injection. But again, if you look at the surface of the eye, you would predict, based on how many blood vessels are here, every injection should lead to eye redness, but it's really not the case. And in many cases, the redness is just underneath the eyelid. That is, we inject the eye down here, and if there's a little red spot, you let go of the eyelid, and the eyelid covers up the red spot. So there are certain situations that can make this more likely to happen, by the way. And this is important to discuss as well. If someone is taking a blood thinning medication, for example, then bleeding, no matter where it is, no matter what happens to someone, is more likely to happen. If you talk to someone who had like a heart attack, or they have a clot, or they've had a heart condition, and those conditions require a blood thinning medication, they'll tell you they get bruises and stuff everywhere. And similarly, if we perform an eye injection, it's more likely to be red, and it's also more likely to last longer. Also, if someone's eye is red for any reason, that is, someone has like a little allergy happening, if the eye is dry, I'd say that's probably the most common reason why an eye could be red, then it's just more likely that we'll run into one of these things. And people who usually require eye injections tend to be over 60 years old. So with age, the eye can be drier. It can be more sensitive to certain things in the environment or to medications or other things that can make the eye dry. And so in a particular population, if the eye is red and kind of already angry and we perform an eye injection, it's more likely to be red. So that's eye redness. In summary, it's not a big deal. Not a big deal at all. If it happens, don't worry about it. It goes away. It's literally like a bruise. There's nothing you can do to make it go away. It's going to make everyone you know ask you questions. Are you okay? But I can assure you it's no big deal. What is a big deal though? Eye infection is very big. It's threatening. It can cause blindness. And when someone gets an eye infection after an injection, we call that endophthalmitis. It's very serious. If it's not treated and diagnosed immediately, it can lead to a lot of trouble. And how does an eye infection happen? Well, if you talk about infections in general, then there are three kind of categories of things, maybe even four, that can cause an infection throughout the body: bacteria, viruses, fungi, and parasites. Well, it's very, 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 very rare that a virus or a fungus or a parasite would enter into the eye with an eye injection. The overwhelming majority, might as well be 100% of infections that occur after an eye injection, is from a bacterial infection. And where do bacteria come from? They come from two places. Number one, they come from the mouth, or they come from the skin or the tears, something like that, the surface of the eye. Now, there are two oral sources of bacteria, the one from the doctor and the one from the patient. So that's why whenever we perform an eye injection, we're very careful about speaking. Now, if you think about it, the doctor really isn't that close to the procedure of the injection. So we don't really think it's that common for the doctor to be causing an eye infection. Nevertheless, we're superstitious about it, and so we decide not to talk during an injection. And when someone is receiving an injection, I also encourage people not to talk. And one can understand why, because when you're sitting there talking, the breath leaves the mouth. It might have bacteria aerosolized in the breath, and so we ask people not to talk. The other source is from facial bacteria, bacteria from the eyelid, from the tears, and so on. So in order to prevent that, we usually place various kinds of things on the surface of the eye. And we're going to be spending a lot of time talking about those things, but nevertheless, we try to take care of that as well. Now, even with not talking, and even with various agents that we place on the eye to prevent an infection, you might ask, how common is it for an infection to happen? Well, some colleagues of mine did a nice little study asking this question. This was a study conducted at the Bascom-Palmer Eye Institute, which is in Miami, Florida. It's a big eye institution. They do a lot of research there. And what they decided to do is look back at a certain time frame in their institution and ask how many injections were performed, and of them, how many patients developed an infection. And that was just one aspect of this study. And then they looked through a database called the Market Scan database. It's listed right here. And they asked, in this database where health information is collected, how many patients underwent an eye injection in the same period, and how many infections occurred. So when they first looked at the database, they found that of the 740,000 eye injections that were performed, 391 developed an infection. So if you do some basic math, it's about 1 in 2,000 eye injections resulted in an infection. And then they looked at their own institution and found 121,000 injections were performed, and of them 20 developed an infection. So the rate of infection at this local institution is about 7,000 or 6,000. Now, a study done in England, so that's the United States and one location in Miami, plus the whole nation. By the way, large database studies are not perfect. There are various reasons why, but we're kind of getting a sense. The rate of infection is really not that high. A study was done in England to ask, what about in England? What about this in this institution? Well, again, in a certain time frame, 21,000 injections were performed, and of them, 4 people developed an infection. So what's the rate? It's about 1 in 5,000. Now, These studies are assessing people with all sorts of eye conditions like retinal vein occlusion, diabetic retinopathy, macular degeneration that require an eye injection. But if you actually look at specific conditions, not a bunch of conditions, but people with one specific condition in one specific demographic, that is, people of a certain age with a certain state of that condition, and we perform eye injections for them, then the numbers might differ a little bit. So in this study, for example, this is a study conducted for dry macular degeneration. Interesting. Again, I have another video on this subject if you're interested in reading about it or hearing about it. 1,200 injections were performed, and of them, 4 infections occurred. So the rate is 1 in 300 in this study. The reason why I'm pointing this out is because you're seeing already a variety of reported risks of eye infection with an eye injection. The risk may be as low as 1 in 6,000, it may be as high as 1 in 300, depending on the circumstances. And we find this across the board. There are geographic differences in the rates of infections for all sorts of things, whether we're talking about eye injections or an infection that someone might have after they've had their appendix removed or their knee replaced or whatever. So geography matters because of the organisms that live in a particular place, given the climate and so on. But also, if we just look at a specific demographic of patients, elderly, young, or if someone just doesn't keep themselves clean very well or whatever, there are all sorts of variables that may influence the risk of infection. And so if we try to combine all of these studies which are reporting various rates of infection, we usually say that the risk of infection is about 1 in 3,000 approximately. And I found this rate to be pretty much applicable in my personal practice as well. So earlier we talked about how do we reduce the chance of an infection besides not talking, for example. And one little caveat, by the way, on the not talking aspect. You might say, wait a second, why don't you just wear a mask during an eye injection? That's a good point. The thing is, when people wear an eye mask, wear a mask, like the most commonly used thing during, for example, COVID was what we call a surgical mask. This is like a little flimsy piece of paper. It's kind of a paper product. And on the top edge of it is this metal bar that you can bend and kind of conform to the shape of the nose. If you talk to anyone who wears glasses, you'll already hear that this is not a perfect mask. And why do I say that? Because if you put a mask on like this with that rubber band behind the ear, and then you put on some glasses, what happens to the glasses? They get all fogged up. So what's happening is the breath that is coming out of the mouth is shooting upward into the eye where the glasses are, and the glasses get all foggy. This tells you that that kind of a mask, number one, it really doesn't seal the face. It doesn't seal the mouth where there's breathing happening, but also, importantly, number two, the breath is being directed right into the eye. So if you actually breathe and you talk or whatever, the breath goes outward, and some of it goes toward the eye, certainly, but some of it goes everywhere. But if you put a mask on, it directs a lot of the breathing in the air from the mouth into the eye. So we actually usually encourage people not to wear a mask, at least that kind of a mask. And we'll discuss that with respect to infection a little bit more, but we usually don't recommend wearing a mask during injection specifically for that purpose. So earlier we talked about things that we can place on the eye to reduce the chance of an infection. There are 3 basic categories of things that we can use on the surface of the eye. Thing number 1 is betadine. Number 2 is something called chlorhexidine. And number 3 is an antibiotic. Now earlier, if we just go back a couple slides, when we were discussing pain, I had a photograph of iodine here as well. So I kind of skipped over that, but because we're talking about this now, let's discuss iodine. Iodine is a source of pain when we place it on anyone, that is. But if someone's eye is dry and angry, something is irritating the eye, for example, one common source is a drop that's used for glaucoma. If someone's putting that in their eye to treat their glaucoma, and yet we place iodine inside of the eye for an injection, then the eye can have some pain. And the pain that comes from iodine is usually a burny, scratchy feeling, kind of like this dull, pulsating ache. The eye can look red on its own as a reaction to the iodine, for example. If we go back to the other drops, so again, iodine makes people feel angry, but chlorhexidine and antibiotics, they really don't make the eye feel that uncomfortable. In fact, there was a study done comparing the use of chlorhexidine with iodine, and when 100 people were asked, some of them got chlorhexidine, some of them got iodine. When people were asked, how did you feel after an eye injection? The people rated their pain on a scale from 1 to 5, 5 being really bad, and 1 basically being mild. The pain rating when using iodine was 1.4 on average, whereas the pain rating for chlorhexidine was 0. 0.4, almost a third less pain was experienced there. So we'll come back to these guys in a minute, but let's discuss antibiotics. Let's discuss this. This is important. Antibiotics, you might think, oh, that would be like a no-brainer. After all, the overwhelming majority of infections occur due to bacteria, and antibiotics are used to treat bacterial infections. And notice what I just said there. Antibiotics are used to do what? They're used to treat infections due to bacteria. Whereas in this case, if we decide to use an antibiotic around the time of an eye injection, we're not really preventing infection. We're just trying to eradicate bacteria in the territory before we perform the injection procedure. Now, when we do that, that is, the rationale is kind of different from our normal use of antibiotics. We're kind of breaking a pretty central dogma of medicine. When we go to medical school, we're taught all about antibiotics and about infections and so on. And one concept that we discuss is something called antibiotic stewardship. That is, if someone is prescribing too many antibiotics to too many people, and people are using antibiotics too often, then the bacteria in the body can become resistant to the antibiotic. Maybe it was originally sensitive, but now it's not. And so it becomes more of a challenge to eradicate an infection due to that kind of bacteria. And so if we're using it with eye injections, and if someone has a condition that requires regular eye injections to maintain their vision, which is quite a few people, then you might imagine will cause some antibiotic resistance. So already it's kind of a challenge to really be recommending widespread use of antibiotics. That's one separate concern, but one other concern is, do they actually work? Well, there are a couple studies that answer this question. This one was done at Stanford University. 129 patients were prescribed topical antibiotics that looked just like this one. Instead of moxifloxacin, it was gadafloxacin. Very similar. Patients took antibiotic drops for 3 days, 4 times a day before an injection. But before they actually started the antibiotic drops, there was a swab that was done. And in this graph that you're seeing here, I'm sorry, it looks a little complicated. The people who were part of the study group were the people taking antibiotic drops. And the people who were the control group were destined to not ever take antibiotic drops, just to use iodine. And this is what the culture positivity rate was before any eye drops were given, whether iodine or antibiotics. So the rates of, in other words, a patient would come to the clinic and the doctor would say, would you like to volunteer for this study? And people said, yes, I'd love to do that for you. And so the eye was swabbed right then, and that swab was sent to a petri dish to see, does any bacteria grow there? And the people who were destined to use antibiotics, the positive culture growth rate was 37%, where the people who were not destined to use antibiotics but were destined to use iodine, their rate was about 50%. And then the patients used the antibiotics, or they didn't, and then the patients returned to the clinic to receive their eye injection. And another culture was performed before any eye injection, before any iodine was used. And here are the culture positivity rates at that point. 47% of the people who were destined to use iodine had a positive culture, but now, because people were using topical antibiotics, the culture positivity rate went down by about 16% in people who were using topical antibiotics. And then all of these patients received iodine on the surface of the eye before an injection was done. And then the eye was swabbed again to ask how many patients still have bacteria on the surface of their eye. And here it is. 8% of people who were using antibiotics still had bacteria on their eye, whereas 4.4% who only used iodine had a positive culture. And then the researchers also took the needle, that is, they performed the injection, they took it out, and then they swabbed the needle to ask if there are any bacteria there. 2.2% was positive in the people using antibiotics, but only 1.5% for iodine. So what you're seeing here is an interesting setup. The people taking antibiotics really did not experience any added benefit when they used them before an eye injection. In fact, the positive culture rate was higher both for the eye after it was exposed to iodine, and then even the needle itself had more bacteria than the people who just used iodine. In other words, and then the other thing to point out here is, why is this not zero? Why is it that before people started to take antibiotic drops, the positive culture rate was 37%, but then after they used the drops, then it's only 21.2%. Why is that? Well, we can all develop our own theories, but asking someone to use an eye drop 4 times a day for 3 days before a visit is kind of tough. I've been through this before. That is recommending eye drops that need to be frequently used. People forget to use these drops all the time. So if that's the case, if we only experience in the best case scenario in a research study that's conducted at a really fancy place like Stanford University, if the best we're seeing is a 16 or so % reduction in the total rate of positive culture before an eye injection is performed, and then we place iodine on the eye and we find that the rate of a positive culture after that is double, should we really be using antibiotics? I say no. There's another study basically demonstrating this exact phenomenon again. That was Stanford, California. What about a different country? This is Israel. In this study, 522 patients were injected, and there's a very similar pattern here. These are the positive cultures before antibiotics were used, and these are the positive cultures after antibiotics are used. So it's the exact same pattern is being reproduced. So anytime we have a scientific question and we find that wherever we test this question, the answer keeps being reproduced, then we get pretty convinced that it's a bad idea or a good idea, depending on the question, to do that thing. But in this case, because we're interested in preventing infection and antibiotics really don't accomplish that task, and we already don't want to use widespread antibiotics for all sorts of other reasons that we discussed, antibiotics are out. So what about chlorhexidine? Remember, going back to this, chlorhexidine makes people happy, huh? Well, chlorhexidine has been studied in various times and places. The first time this was really studied in a very rigorous way was in Australia. In Australia, 40,000 eye injections were performed using just chlorhexidine. There was no comparison made. That is, the researchers didn't say, okay, let's use chlorhexidine for this group of people, let's use iodine for that group of people. Let's just use chlorhexidine and that's it, and see what we can find out. So when they performed this procedure, they found that the rate of infection was 1 in 13,000. Now, if you remember when we first started this talk, I was showing you various publications suggesting that the risk of infection is something like 1 in 6,000, 1 in 2,000, 1 in 3,000 on average, but this is 4 times better than that. Whoa, that's crazy, isn't it? Well, in Australia, they perform eye injections a little bit differently from the United States. First of all, they go to the operating room, but also there are various ways in which this is done. This is a description of the retina specialists who are performing an injection there. There's 1, 2, 3, 4, 5, 6, 7 retina specialists performing this 40,000 number of injections. This is a nice little table describing what did they do. They almost all wore a mask By the way, the kind of mask that they wore was not what we were discussing earlier, like a paper flimsy surgical mask. They were wearing like a rigorous N95, really tight, headache causing mask. They almost all used sterile gloves. They'd use different concentrations of chlorhexidine, but it's pretty uniform. And then they describe other things, and the most important thing is most of the doctors let the chlorhexidine sit on the surface of the eye for a long time. Then a bunch of people were draped because they're in the operating room, for example, and then the locations of the injections are described. In other words, when the retina specialists are performing this injection in Australia for the purposes of this study, they were really, really, really cautious. They let it sit on the eye for a while. They used sterile gloves. A bunch of them wore masks. It was done in the operating room. And so we think that this is probably why the rate of infection was a lot lower. Now, if we go to a different kind of study in which we actually make a comparison, this one was done in Canada. So remember, the first one was just, let's inject these 40,000 people using chlorhexidine, no comparison, let's just see what we get out of it. Whereas in Canada, a study was done assessing 170,000 people using either chlorhexidine or iodine. And let's compare the difference. Now, the procedure that was done in Canada was a little bit different than what was done in Australia. In this study, what the researchers did is they brought the patient to the clinic, they numbed up the eye, and then they placed a drop of iodine on the surface of the eye for 30 seconds. They just took a little Q-tip, dipped it in iodine, put it on the eye for 30 seconds, and then performed the injection. And they did that both for iodine and chlorhexidine. So what were their infection rates? Well, of the 31,000 chlorhexidine injections, 20 had an infection. So the rate of infection is about 1 in 1,500 in this study. Whereas in iodine, it was 29 over 139,000 injections. So that results in about a 1 in 5,000 rate of infection. So this is the part of the study where I was describing the technique that was used. They say, we chose this or that antiseptic. We applied it onto the surface of the eye for 30 seconds with a sterile Q-tip before. So a lot of people have looked at this study and said, the way you perform the injection in Canada for the purposes of this study was very different than what was done in Australia. In other words, in Australia, it was all sorts of fancy gloves and masks and operating room and drapes and all sorts of stuff. Whereas in Canada, it was single Q-tip on the eye, 30 seconds, and the injection was performed. And this probably explains why the rate of infection was higher for chlorhexidine. Because in the Australian study, the researchers there, they waited a lot longer when they performed the injections, where in this case they're doing about 30 seconds. So this probably explains why the rate of infection is higher for chlorhexidine. Well, these aren't the only studies that have been done to compare iodine with chlorhexidine. Another one was done last year, and this was done in Colorado. There were 13 retina specialists in Colorado who performed a bunch of eye injections. It was 67,000. And the way they performed the injections was just like what I do. That is, the patient receives a drop of either iodine or chlorhexidine, and it sits there for a while. We usually let it sit in the eye for at least a minute, if not longer. When that happens, then all the bacteria on the surface of the eye gets eradicated. And then once it's sat there for a while, then the doctor can perform whatever kind of anesthetic procedure they want. At least this is how it was done in this study. So they anesthetized the eye either with eye drops or with a lidocaine injection. And then they also placed an added drop of either iodine or chlorhexidine before the injection was performed. And then they reported their rates of infection. And here they are. So for iodine, the rate of infection was about 1 in 4,000 or 1 in 3,800. Of the 34,000 injections that were performed, 9 people had an infection. Whereas of the people in the chlorhexidine group, 13 of 32,000 had an infection, which results in a rate of about 1 in 2,500. So this study it's more in line with what we do in the United States. So it's obviously so. It's done in Colorado, whereas in other countries the methodology is a little bit different. So we see different rates of infection. So if this is placed, this including anything like iodine, is just placed on the eye for 30 seconds, we would theorize that the rate of infection would be higher, and that would be especially true of chlorhexidine. It has to sit on the eye longer than iodine, we found. And so when we actually do the procedure the way that we ought to, specifically in this Colorado study, we find that the rate of infection is actually comparable with iodine as well. And so if we have our options, if we say that iodine does a really good job of preventing infection, and then we test iodine against chlorhexidine, and people feel a lot better after using chlorhexidine, and when we perform a study in which we find the rate of infection is actually quite low, it's comparable, in some cases better depending on the technique with chlorhexidine, we should use that instead. We certainly shouldn't do antibiotics. And the reason why we should do chlorhexidine, at least in my opinion, is because I want my patients to feel good. Remember, you're talking to a guy who doesn't like any eye pain. So that's why we do it this way. Now, the final part about this whole procedure is, what is recovery like? That is, what should I be doing after an eye injection, and how long will I feel not happy? The specific question of what should I be doing after an eye injection is really confusing. We haven't studied it the way most people want us to. Now, we'll return to that subject in a minute, but let's first ask, how do people recover after an eye injection? What's their experience like? Well, this was a study done assessing 1,400 people who are using iodine during injections. So if we use iodine, then people feel a lot more pain. It's more uncomfortable. It's not necessarily totally difficult to recover from, but this is the experience. If we were to repeat this study using chlorhexidine, we'd probably have a different kind of experience. But nevertheless, in a scenario in which iodine is used, this is how people tend to report their recovery afterwards. So the patients were given a survey. This is a sample of the survey. And one question 24, for example, it says, how long after injection does your pain or discomfort last? And if it lasted for a while, there were more points added to this whole poll that was given. And this is the breakdown of the scores. So the middle here of 0 out of 50, the middle is 25. You can tell even with iodine, people tend to tolerate injection pretty well. And when the patients were asked, how long does it take you to feel normal again after an eye injection? Notice that 27% of people added together, they need 8 hours or less to recover after an eye injection. Now, about a quarter need less than 3, but 27% need between 4 and 8. And then there's some outlier patients, like for example, if we return back to this graph, again, cutting the line in half, there are certain people over here who are really sensitive to iodine, for example. It takes them longer to recover. And we see that here. Greater than 13 hours, 12%, or between 8 and 12, 8% of people need that long to start to feel kind of normal again. And I would imagine these people have really dry eyes. Maybe they're using glaucoma drops that irritate the eye and so on. So this is what the experience can be like, particularly with the use of iodine. Now, the other question about recovery is what I mentioned originally. What should I be doing after an eye injection? Now, there are a lot of opinions about this. I want to show you a brief sample. Let's go to England. This is University Hospitals of Leicester. Okay, so this is England. What do they tell you to do after an eye injection? Don't get your eye wet for a day, and don't exercise for a day. Okay. Oh, they also say don't drive your car for a day. So don't get your eye wet, don't exercise, don't drive for one day. Got it. Here's another hospital within the NHS, same country, different city, different location. And what do they tell you to do? Don't rub your eye. I agree with that. We usually tell people not to rub the eye anyway. Don't get water in your eye or swim for a couple of days. Don't wear any makeup for one day. So Leicester says don't swim or get the eye wet for one day. They say a couple, and now they're mentioning, this hospital's mentioning makeup for a day. Don't wear any contacts for 2 days, and then take all the eye drops you want to take afterwards. Got it. This is a recommendation from the Macular Society. So we just saw what some hospitals in England are recommending after an eye injection. The Macular Society is a European organization, and they have a lot of helpful information for people who have diseases of the macula, like macular degeneration, for example. And because a lot of people have macular degeneration are receiving eye injections, they have a little blurb about eye injections and what should you do after an eye injection. So what they say is, for at least a week, don't swim, put on makeup, garden, or do any physical sports. So in one hospital in England, they're saying for a couple of days, or one day, or whatever, whether it's water or driving or makeup or whatever. But the Macular Society is a lot more conservative. They're saying don't do those things for a week. Here's another hospital in London. Same, in England anyway. Don't put any water in your eye for a couple days. Don't wash your hair for a couple days. Don't go swimming or putting contacts for 5 days. You sensing a theme here? This is Australia. This is a clinic in Australia. They say, okay, because they do it in the hospital, they're sedated. So that makes sense to me. If you go to the hospital and you get sedatives, you shouldn't be driving a car. You're drunk. So they say, don't drink alcohol. Don't do a bunch of things for a whole day after an eye injection. Makes sense to me. They say don't do lawn bowls. I guess that's an Australian sport. Fishing, golf for a day. Don't swim for 2 days. And then don't sleep on the side of the eye injected for the first few days. Got it. Here's another this is another example. This is a company that makes something that's injected into the eye, and they really only say don't drive. They don't say for how long. They don't really mention anything else. They say look out for this and that, but don't drive. Got it. Let's go back to the Bascom Palmer Eye Institute. This is that big famous place in Miami. What do they say? They say don't swim or hot tub for a day. Wash your face, take a shower as much as you want. Don't look directly into the water. And then take all the eye drops. So I hope you see what I'm talking about. We've never really studied this. I think a lot of these people here, they mean well. They're trying to help their patients, and they're trying to suggest that people be cautious after an eye injection. And I don't disagree with that. But if we're going to get down to very specific recommendations about swimming, bowling, fishing, makeup, contact lenses, we've never tested this in some trial. And therefore, there's going to be a lot of confusion about what to do after an eye injection. Should I put on makeup? Should I put on my contacts? Can I use these drops? Can I take a shower? When people ask me this question, what I do is I tell people, go about your life normally. Go about it normally. And why is that the case? I've performed eye injections for a lot of people. I've injected people who are lawyers and other doctors, secretaries, people who are nurses. Nurses are going through the hospital. They're exposed to all sorts of infectious stuff, for example. I've performed eye injections for people who are construction workers, for people who are farmers. If you talk to a farmer, let's say they're a rancher, they have cattle, they have to feed their cattle. Otherwise, their cattle will be hurt. Some of them will die. It's critical, especially in the winter, that they feed their cattle. And so if you tell a farmer you can't go back to the field for a whole day or for 5 days or a week, they'll laugh at you. That's their livelihood. And I've injected these people too. And I've never seen a trend where I find that the people who are farmers or construction workers kind of getting dirty have some higher rate of infection. I think it makes a lot of sense. Why? Because it's a moment in which an injection is performed. And during that moment, we place the antiseptic agent, whether it's iodine or chlorhexidine, on the surface of the eye, and that completely eradicates the bacteria that are on the surface of the eye. We perform the injection, and then once we remove the needle from the eye is closed off, hermetically sealed from the world. So just understanding the mechanics of this tells me that it really doesn't matter what people do after an eye injection. Now, certainly one can, again, understand certain aspects to this, like if you're in Australia and you go to a hospital or like an operating room and you receive sedatives because you're in an operating room, yeah, you shouldn't drive a car because you could hurt yourself. You're basically drunk. Or if an eye is feeling itchy or scratchy, it might be kind of tough to drive a car like that. Like if someone has to keep their eye closed because it's irritated while they're driving a car, you can imagine that would be potentially dangerous. Or if there's pain afterwards and you don't feel like you should go to work because you're in pain, totally makes sense to me. But with respect to the specific recommendations that are related to prevention of, let's say, infection, I see no specific thing that would prevent that from happening after the injection has been performed, because we've already thought a lot about how to prevent it in the clinic. Now, here I say look out for bad signs. What I'm really referring to are the signs of infection. And what are they? The signs of infection universally are really bad eye pain, and not just any eye pain. Again, we know that pain can happen during or after an injection. Less so with chlorhexidine, more so with iodine. That pain should go down over the course of, as you recall, hours. Maybe 3, 4, 5 hours, the pain should be going away. But if that happens, and then the next day or the day after that, the eye gets in a ton more pain, it starts to get redder, things become swollen, the vision is getting worse, that could be an infection. And if that's the case, you need to be seen immediately. And I say immediately, and you need to see a retina specialist too. If you decide to go to another place, like you see someone who's doing like LASIK or cataract surgery who's not a retina specialist, they will send you to a retina specialist, which is the appropriate recommendation because we are the people who treat this. I've treated my own infections. I've done enough injections that I have personally caused an infection. And when I find it, I treat it immediately and people have a good outcome. It still can be very serious, but these are the things to look out for. Any loss of vision of any variety should be brought up as well. So if you receive an eye injection and the vision is really bad, we need to look at the eye as well. So anytime someone has an eye injection in my clinic, and then we get a phone call saying, "Doctor, my eye is not feeling right," I immediately invite people back to the clinic, and that's the most appropriate recommendation. So, in summary, today we've talked about eye injections. We've talked about certain conditions that we treat with eye injections, why we like them so much. We talked about how they cure blindness and they prevent blindness from recurring. So some people get regular eye injections. But then we spent the bulk of our time talking about the risks: pain, eye redness, and infection. We talked about that pain is a temporary thing. Same thing with the redness of the eye. It's not serious, even though it looks serious, even though it looks ugly, it's not. It goes away on its own. And then we spent a lot of time talking about infection and recovery after an eye injection. So, like I said, my name is Zackery Oakey here in Irvine, California. Thank you for paying attention to this talk if you made it to the end. If you ever decide to come by my clinic, I look forward to meeting you. All right.